Ronald McDonald House Charities of Central Indiana provides a supportive home away from home for families of children receiving medical care at Riley Hospital for Children at Indiana University Health and other area hospitals. When families stay there, they're close to the hospital, have access to warm meals, and get to sleep in comfy beds. Ronald McDonald House Charities gives families the ability to spend more time with their sick children, to interact with their doctors, and to make important decisions about their children's care. Research shows that the Ronald McDonald House program supports a family's psychological well-being. Families who stay there have a better perceived quality of life.
My name is Esther Philpus, and I'm married to Mark for 16 years. We have 3 children. Lydia's 14, Simeon's almost 10, and Naomi is 5. Naomi began having symptoms of pain and nausea, some fatigue last fall, and those symptoms were sporadic, so it was really difficult to diagnose. We took her to the doctor a few times. It really came to a climax where she wanted to lie down on the couch for almost a whole weekend in January. So we took her back to the doctor, and they had done a CT scan at that point and realized that there was a tumor in her left adrenal gland. She had a biopsy, and that determined that she had stage 4 high-risk neuroblastoma. We found the Ronald McDonald House through our social worker. She was planning things for us during stem cell transplant time and asked if we'd be interested, and we said absolutely. Our relationship with the Ronald McDonald House has actually gone back about 10 years. So 9.5 years ago, our son had open heart surgery to correct a congenital heart defect. We were here, I believe, for maybe a night or two during that time, and that's where it began. And now we have an apartment here while Naomi goes through stem cell transplant and radiation.
In my role as the medical director of the stem cell transplant and immunotherapy program at Riley Hospital for Children, I take care of some of the sickest children in the state. Our patients are all undergoing life-threatening therapy through bone marrow transplant as a treatment for their cancer or their immune deficiency or other disorders. And so my role as it relates to the Ronald McDonald House is to care for patients that also are cared for by the Ronald McDonald House. Many times we will ask families to stay nearby the hospital even upon discharge so that we can keep close track of how the kids are doing. And then they're right across the street from the hospital. If a problem comes up, they can just immediately come over to the hospital without having a long commute. Ronald McDonald House has been an absolute lifesaver for not only our patients, but also us as the team providing the care for the patients. We all have a peace of mind knowing that there's a place for our families to be. Even when kids are in the hospital, it provides respite for our families to be able to take a break from the hospital environment. Riley Hospital has the distinction of being the only stem cell transplant program in the state of Indiana, which means that we have many patients that live far away from Indianapolis. And so to know that we can feel comfortable to discharge a patient from the hospital, knowing that they will literally be just across the street, is really very impactful for their care. Family-centered care is so important in what we do, partly because of the life-threatening nature of the therapy that we provide, really trying to put patients at the center of that, especially when it's a long and chronic journey for these families. Really trying to make everything else that's non-medical easy for them is really important. These families go through a lot, and they're, just in the emotional, mental, physical, and financial tolls that they go through and getting care for their children. And so really being able to put the family first in every consideration that we choose as a medical team is really critically important to getting them through it intact.
Our family's experience with the Ronald McDonald House has been nothing but positive. It has been a home away from home. It has been a place of respite for me, a fun place for Naomi to come and see Mac, the dog. Staying at the Ronald McDonald House has been incredible help to me. As they say, if you don't put on your own mask first, how can you help somebody else? And that's the same with Naomi. I'm her main caregiver here, and I'm her number one cheerleader and her advocate. And how can I do that effectively if I myself do not have the rest that I need, the comfort? Raleigh does a really great job at taking care of the parents the best that they can. But the reality is, if you have to sleep there at night with beeps sounding at all hours and a small couch to sleep on, it's not comfortable and it's hard to get rest. Being able to stay at the Ronald McDonald House has been incredible. It's being able to put my own mask on first before I put on Naomi's mask, and I'm able to be an integral part of her team, of her care there, and I have support even when I come here, whether it's with other parents, with the staff who are so kind. It's been really great. Supporting the Ronald McDonald House is an incredible way to impact so many lives, not only the lives of the sick children, but their families and their friends. The impact goes far beyond what you could even imagine. It brings comfort in a time of crisis, and it is just a blessing beyond what can be even calculated.